Getting prior authorization for a medication like Zerbaxa can feel like an uphill battle. If you've ever had to navigate the paperwork, insurer guidelines, and back-and-forth communication, you know how frustrating it can be. But it doesn't have to be overwhelming. In this video, we'll walk you through the prior authorization process for Zerbaxa step by step. This will help you save time and ensure your patients get the life-saving treatment they need. Zerbaxa is a powerful combination antibiotic used to treat serious infections like urinary tract infections, intra-abdominal infections, and hospital-acquired pneumonia. Because of its high cost and specialized use, insurers require prior authorization to ensure that it's prescribed appropriately and only when necessary. You'll need to prove medical necessity, show that other antibiotics were tried or deemed unsuitable, and provide thorough documentation to support your case. The first step is gathering all the required documentation. You'll need the prescriber's order, including the diagnosis, dosage, and planned treatment duration. Be sure to document the patient's infection history and explain why Zerbaxa is necessary. Include records of step therapy, showing other antibiotics that failed or were inappropriate, and provide diagnostic results like cultures or imaging studies. Finally, make sure you have the insurer-specific prior authorization form ready. Accuracy is critical in this process, so double-check your ICD-10 and CPT codes. These codes need to align with the patient's diagnosis and treatment plan. For example, common ICD-10 codes include N39.0 for urinary tract infections and J15.0 for Klebsiella pneumoniae-related pneumonia. For CAPTAIN codes, Zerbaxa administration might use 96365 for IV infusion or J3490 for unclassified drugs, depending on the healthcare setting. Once your documentation is ready, submit your prior authorization request using the insurer's preferred method. Many insurers now use online portals like 𝗕𝗲𝘪, which can speed up the process. If those aren't an option, fax or mail submissions are still accepted, though slower. Some EHR systems also integrate with payer platforms for direct submissions, so check if yours has this capability. Don't stop there, be proactive with follow-ups. Call to confirm the insurer received your request and check for updates regularly. Response times typically range from 48 hours to 14 days, but delays happen, and staying on top of it can save valuable time. If the insurer asks for additional documentation, provide it promptly. If your request is approved, verify the patient's copay and out-of-pocket costs, and confirm the treatment timeline. Check if the approval has an expiration date or requires renewal. If the request is denied, don't lose hope. Carefully review the denial letter to understand why, and then file an appeal. Most denials happen because of incomplete documentation or unmet criteria, which can often be resolved with updated evidence or a stronger letter of medical necessity. The key to success in this process is thoroughness. The more complete and accurate your submission, the smoother the process will be. And remember, appeals often work if you approach them with the right information and persistence. Now, if managing prior authorizations like this one feels like it's taking too much of your time, outsourcing can be a game changer. Companies like Staffingly specialize in handling prior authorizations for medications like Zerbaxa. With 24/7 support from experts, they manage the heavy lifting, including gathering documentation, submitting requests, and following up. They can save you up to 70% on administrative costs, allowing you to focus on what matters most, caring for your patients. Prior authorizations don't have to be a nightmare. With the right steps, a proactive approach, and expert support when needed, you can make the process efficient and stress-free. Thanks for watching, and don't forget to like and subscribe for more tips to streamline your healthcare operations.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.